What if the very advice you trusted to keep you healthy is the reason you're still stuck? Decades of broken beliefs from the healthcare system, combined with providers too rushed or unsure to give you clarity, have left people confused, hesitant, and afraid to try anything new. In this episode, we're exposing why you've been left spinning your wheels and how to finally break free. Hey, welcome to the Diabetes Remission Roadmap podcast with the two renegade pharmacists, Brian Bisher and Cory Jenks. You are listening to this because you are a person with type 2 diabetes who is committed and driven to breaking free from this diagnosis and creating a real, meaningful change in your health and life. In these episodes, we're here to help you ditch the scripts with doses of unconventional wisdom on topics such as fitness, nutrition, medication, mindset, and more. So without any further delay, let's dive right in. Cory, what's that hat you're wearing?
It is a Tucson Saguaros hat. It is from the Pecos League. Don't you follow the Pecos League, Brian?
All
It's
the time. I check
the
their.
unaffiliated, non-professional baseball league. That's awesome because 100 people go to the game and my kids leave with a foul ball every time. So their
Now,
expectations of foul balls at major league games are totally unrealistic, and it always leads to sadness. And so it goes.
yeah, I'm here supporting the Reds. But on
Mhm.
that note, I've never actually gotten a foul ball at a Reds game. So
No,
I'm
but
about to start.
your kids did get a baseball at a game that we went to together. Remember?
I don't know if I
2 years
remember that.
ago, we went and visited you, and we met the mom of one of the Reds coaches. And at the game, she gifted us with balls and hats.
That's right. Okay.
And
Yeah,
this is
I'm.
why you should, okay, so if you're listening, this is why you should never steal a foul ball from a kid at a game because you'll forget about it, but you'll be vilified on national TV. So just know that. Just give the ball up if you're a grown up because you're going to forget about it anyway. Um,
Yeah. But what
so
else should people give up? Because I think they should give up
this should,
some beliefs around diabetes, right? Or at
mhm.
least some of the things they just need to give up the beliefs that hold them back, or some of the things that are holding them back when it comes to having diabetes. And I think this really is important because we hear this all the time. Why hasn't anyone told me that? Like, no one has literally told me what you're telling me right now, Corey. You were just sharing with me before we started recording that that's what you heard in your clinic today or this week, right?
Yeah, I had the last patient I saw this week came to me because their A1C was in the teens, and he's going through a lot. They're going through a lot of health stuff beyond their blood sugar, and they had come a long way in where they were. But I asked him, do you want me to go through like some recommended foods? He's like, no one's told me anything, and I think that's a giant failure of the healthcare system. I think the knee-jerk reaction in our average 8-minute appointment from a doctor is to dismiss patients because they're non-compliant, they don't care, they don't want to listen, they don't want to do anything. When the truth is, the providers don't have the time nor will or desire to give the information because the standard of care fails so often, and there is such little typical reversal. They've sort of like providers are conditioned to not care and not give the information, so the patients aren't given the information, so they fail and they feel worse. It's this vicious cycle of crap that when you take like literally 5 minutes of talking to someone about basic stuff about diet and exercise, and they're like, this is doable. No one's told me this stuff before. And I'm not trying to make them sound dumb by like saying it like that, but it's like the earnest surprise that I got from this guy. It was like a bad infomercial. Like, I didn't know I could cut tomato with a knife and not have it be dull. I need to buy the Miracle Blade Perfection series, which I've made my parents buy when I was a kid. So I'm a sucker for an infomercial, but I'm a sucker for a story of turning it around, of getting this confidence through clarity. Like it just takes a little bit of clarity, and people are off to the races.
Yeah, I mean, I have so much to really ask here, and I'm just so curious. Why is it that some of these things are so obvious, like reducing like, why is that not something that why do they need to be told this? I guess, like, why is this like,
I would argue because the standard of care for years was to eat more carbs. Like we had a food pyramid. We're elder millennials, or I'm an elder millennial. I grew up with the food pyramid. The base of your day was 12 servings of grains or carbs. And most folks don't understand that these food guidelines were developed for healthy people, and the ones who are no longer healthy, that these food guidelines should no longer apply to you. Not that they were good to begin with. So think about how we're educated, how providers, dietitians, the people that control your food recommendations are educated in the way of like you got to make your base of your day grains, and now you have a condition where you're intolerant to carbs, and the answer is like just eat them betterly. Like it's terrible advice. And I think there's a part of it that's ego. Like no one wants to think that they believe something for their whole career that's been bad advice. And I certainly can see that. And I say this as a pharmacist who's changed his beliefs. And you might be nervous, like he's going to change his beliefs. Well, when better evidence presents itself, I'm going to change it. I'm not going to be stuck to these firm beliefs. And I see it when food becomes religion, like whether vegans who think that any animal product ever will kill them when they're just bodies starving for B12, or I recently saw some data on people who do carnivore whose gut microbiomes are garbage, and they get angry at the messenger saying, "You might want to put some like fiber in your diet." Well, no way, it can't be that. Carnivore's perfect. So it becomes part of your identity, and I think your identity should be living a life that makes me healthy and happy and strong. And if something changes, so be it. I mean, I could tell you the ways I've varied my approach to eating in my life. It's because there's new evidence, because we're learning new stuff. And if you ain't learning, you're withering away and you're going to be left behind.
And pile on the medicine. Uh, so yeah, but then like so diet that makes sense with the food pyramid. But what about like
Mhm.
exercise? When you, I mean, when you're telling these people, they're like, "Why has no one ever told me this before? Like walking is going to be good for me." Like, is that
Well,
the kind of
which
reaction you get to walking too?
I will say this, walking is good for you. Don't stop walking. But I think what we're told is you have to get X number of minutes a week of exercise, and walking is a very baseline entry level thing that people can do. But most providers are not educated on the idea of the glucose storage problem, the building a bigger storage tank for your glycogen stores, aka building muscle, aka lifting weights. And also, most providers probably don't lift weights themselves, so they're not comfortable providing recommendations. Like they walked into the clinic, they can walk. I can tell you how to walk. Walking's good, but I've never lifted a weight myself. I can't tell you to lift weights if I don't know what to do. I don't know who to recommend because you can't get hurt exercising. But I don't know. We live in the world of YouTube and Instagram, and you could find an exercise program. An AI could put together an exercise program for you. I'm not going to say it's good or you do it right, but they've never been told it. And providers don't have the clarity, right? They don't have
Mhm.
the clarity that this, so if they can't have the confidence and clarity to knowing this would work, they're not going to recommend it. You and I have done this for hundreds, if not thousands of people. We've seen it. We've seen it work. So the evidence supports it. The mechanisms support it. So we have the confidence to say it, and then we have the bandwidth here on a podcast to at this point froth at the mouth about it.
I was gonna just be like, all right, let's pause here because I think we need to really break this down. So someone wants the clarity, or how do they get clarity on what to do? Or just tell us what exactly did you tell this person? Distill it
I
down as simple as possible
I mean,
so that
in my 20-minute visit that I get, I tell them I have three basic diet pillars. Focus on protein first, focus on fiber, which is code for eat your vegetables, and limit your sweets, carbs, and starches and added fats. Three pillars. And I start with the first two because I want to focus on the doing behavior, like eat more of
Mhm.
this, eat more of that, filling in the world of that. And then I'm going to tell you that these are the things, these levers to pull to cut back on that you don't have to do, but are likely going to improve your sugar and your overall metabolic health. Okay. And then the other thing I tell them is, as first I ask them, have you ever been inside of a gym? Have you ever lifted weights? What's your schedule like? If the answer is no, no, busy, or if their answer is yes, yes, busy, or I have time, I give them a basic, literally 30 minutes a week of strength training exercise plan. Basic stuff with the assurance that it will take time. They might not see results right away. Along with, I'm going to tell them, I do tell them to walk, Brian, like a simple 5 minute walk around meals, starting with these like simple basic building blocks. Like you cannot build a house without the foundation. And the foundation is literally a hole in concrete. It's basic stuff, but your whole house falls apart if you don't have it. And so that's where I want to start with. And I want to talk to them about it's not like I want them to like have grace for themselves as they're doing this. This is hard. It's a tough food environment. You've been eating this way for 30 years. You've been told these other things. And then I ask them, are these things working for you? And they say, well, I'm here in your office with an A1C of 13. So no, it is not. So then I say, well, we should probably do something not what you're doing, right? Okay, we'll make these changes and then we track. Do you get better? Great. Do you feel better? Yes, no. What do you like? You hate cottage cheese? Well, I will not recommend that. Like tell me if anything I'm saying sounds terrible, tell me and we'll modify. So I keep it very simple because I get 20 minutes and then every 8 weeks I can check in. So I have to give them the simple building blocks.
yeah, and that's why we're doing what we're doing now because it's way better to have more hands-on approach
Hmm.
to give them, hold their hand not just every 8 weeks not for 20 minutes, but continuously. So if there are questions
Mhm.
that arise,
Mhm.
because even then, like there's limitations. You're in a clinic and people are they're bound to have trip ups or things that get them set them back in the 8 weeks that they see you. Like that's
Mhm.
just bound to happen. So we got tired of that happening and we're like, can help more people. So, anyways, that's why we're doing this podcast. That's a side. Um, but I think I really want to get into now. So, what are the things that are going to hold someone back from adopting this new clarity, like around like that are going to help them, they're going to prevent them from shedding these beliefs that they've been just holding on to for their whole lives,
I
basically.
would say uncertainty because they've been told all these things to do and they've not worked. So why would this new thing work? And I think that's where having the the evidence and the empathy and the sort of like seeing into the future of you might feel this, this, and this. I think that's one of the things we don't do. What any intervention we do in healthcare, whether it's a medicine, a surgery, we don't talk about what the expectations are very well. It's take this pill and hopefully your sugar gets better. Versus when you take this pill, you might feel this side effect. You might feel this effect on your sugar. You might feel this effect on your muscles. So that when they happen, we humans don't like surprise, and when we're surprised, we get scared, we back away because we don't have the vision, the clarity. And so what we are trying to do to like shed these beliefs is give them these new beliefs as options, help them know what to expect with those beliefs, and then give them the confidence that these beliefs are going to lead to a new identity of one with
Yeah.
better blood sugar and not needing medicines and coming to see the doctor less and telling the doctor to listen to me because I can help your patients too. That's what my favorite thing is like you've ignored everything I've done and I'm better. So either listen to me or I'm finding a new doctor.
Yeah. Yeah. We're back to that, back to the finding a new doctor because it is crazy how many of them just like, oh, yeah, that's great. Yeah. Anyways, now we talk about confidence. You don't just develop confidence, it doesn't just appear. That's why people like, I tell them you need to build the skills. So right now, wherever you're at, you've just developed the wrong skills. You are literally a compilation of the skills you've built up until this time. Like your
Yeah,
metabolic health
it's
is.
basically all the life scripts you've been handed. Like we hand out prescription scripts as pharmacists. Like you have these life scripts that you've been given or believed that we have to rewrite these scripts. And it takes simple building blocks. You don't write a novel by writing a novel. You write it by writing a letter at a time and developing
Yeah.
the confidence that, and I've written two books. Like you don't sit down and write 200 pages at once. You have an idea and you write, and sometimes your first draft is messy, and you edit it and you adjust and you do it without ego. You do it with curiosity. You do it without judgment because like we have kids, they're learning skills, writing, reading, sports, and they're not good at it when they start, and they get really freaking pissed and frustrated. And you look at it as like a kid, like why would you expect to know how to do that? Well, if you've never been taught these skills, it's literally a practice, a lifelong practice. And
Yeah.
having a guide, having a sort of roadmap, aka roadmap to remission, makes it less scary. It's why we love GPSs on our phones. We know which way we're going. We know when we're going to arrive. We know when there's an accident now. It's amazing. And so the more clarity you can have of what that road's going to look like and how to overcome the roadblocks, the better you're going to be at overcoming the roadblocks and rewriting your own story.
Yeah. Isn't it amazing when you can do type in a GPS destination like 800 miles away and it's going to tell you an accident that's like 600 miles down the road. And you're
Mhm.
like, well, hopefully that clears up by the time I get there. But if not, I can find an alternative route. And like it's the same thing here is well, sometimes accidents could happen like literally right in front of you and derail you, make you just get you stuck. But we and the roadmap is here to like help you divert and find different solutions, different approaches, because cookie cutter things do not work. I think the GPS is a great example, just to really bring this analogy home. Um, and yeah, like confidence takes time to build the skills, to build the
Mhm.
competence. But in order to have the competence, you need to have the clarity around what to do, what skills to practice, so
Mhm.
that you start to unlearn some of the negative habits that have gotten you to where you're at. And
Yeah.
you got to come up with an open mind.
Mhm. And maybe you have competence. Maybe you've read the books and listened to the podcast, but you don't know how to put it into action. And that confidence grows by doing the reps.
Yeah.
Confidence is a muscle you build like your biceps. It just you don't get big old biceps looking good at the beach after a set of curls. It takes lots of repetitions and practice. And I think a lot of people we take care of will say, well, like I know what to do, I just can't like do it. And so that's where we like to break it down into simple, pardon the pun here, digestible changes when we're talking diet, hey oh, right, and help you rebuild that confidence, rebuild those reps, so that you have this beautiful vision, like this beautiful sculpture at the end. That's this combination of competence and information and clarity and confidence that you can go out in the world and rewrite your life script. And that's one without type 2 diabetes.
Yeah. And I want to just say underneath all this, you have to have a meaningful purpose or reason for doing this. And I want to hear from you because I know you've talked to a lot more people recently. Like, what are some of those moments where people are just like, I just need this needs to happen, Cory. Like, this just happened to me.
Mhm.
I need to make changes. Like, I'm very open to shedding these beliefs that have held me back, these habits that have held me back. Like, just walk us through some of those moments
What
people have.
one of them, like one reason is they're pissed that they let it happen to themselves. Another, like they're just upset at a system that failed them, so they like want to get back at it. Another is the person who's like, I've always been healthy and now I'm not. I got to get back. Like they identify with that healthy person, so they want to get back to that healthy person. Another reason is fear of medicines. I don't want to take medicines. I don't want to shoot up insulin. I'm like, oh, I wouldn't want to either. So what are we gonna do about it? So and then like yeah, then there's like the type A's that are just like full of grit and determination, and like I think they just like solving problems. Like a lot of them are retired professionals or current professionals that can just like knock stuff out in their careers or families and lives and friends. And it's like, well, I've gotten to this point. It's a new challenge. Give me the tools to do it, and let's go freaking do it. And those are like all of those scenarios are fun. Like doing it out of spite, doing it out of fear, like is very motivating. Doing it out of like a challenge, and then just doing it knowing the reason why is they have so many people that depend on them. They're leaders in their life. They have to lead with their health, and if they don't, then they're the people that support them. It's like that foundation. That foundation crumbles if they aren't able to take care of themselves. So many reasons, and there are more. I probably have not. I've not listed. They're not exhaustive. If you have a different reason for yourself, send us a message, comment, let us know. We'd love to hear it,
Yeah.
because we love growing this catalog of reasons why we want to do what we do.
Cory, take us home.
Brian, you are so full of excitement. Your words can't get out of your mouth, and it's just the cutest thing. So, this episode, if you're looking for like tactical tools to manage your blood sugar, you might be like, what the heck, guys? You didn't give me a whole lot of stuff. Cory gave his 5 minute spiel in 30 seconds, and you're right. But the truth is, this competence without the confidence leads to lack of impact. And so, a lot of this is about rewriting your story, getting rid of those false, bad, poorly written stories and scripts about yourself. And Brian asked me, what are the things that trigger this? And it's getting a bigger why. Because there's people that have diabetes for 30 years come into my office and say, okay, now I'm ready. It's like quitting smoking. You're used to a certain way of being. And human beings, even if the status quo kind of sucks, isn't uncomfortable, we stick to it. We like the status quo, even if it's bad. It's the devil you know versus the devil you don't. And embarking on a journey to reverse your type 2 diabetes, it's an unknown to a degree, right? It's venturing into new territory that you don't necessarily have that GPS for unless you find a guide. And we'd love you to watch our masterclass to help get a little of that clarity on the road. So while you might be wondering where the tactical tools today was, I think that it's often overlooked. I think doctors and healthcare systems treat people like little robots and machines, and we are not that. We have emotions and feelings and fears and wants and idiosyncrasies that don't fit well with a plug and play model. And so we've got to figure out our why. We've got to get clarity. We'll get confidence, and then you're off to the races. So Brian, thank you for
Yeah.
wearing your red shirt today and reminding me of that fond memory that you had forgotten about me hooking you and your kids up with baseballs and hats. So
Yeah. Yeah.
I'll make sure that our kids bring their Reds balls the next time we visit to help remind you of the magical time that these strangers from Arizona came and your kids got memorabilia at the Reds game.
Yeah.
So no, I'm
I should
kidding.
have taken a picture.
Yeah.
No, I think we probably do have a picture.
I have that picture. I will send it to you. We'll post it in the show notes. It's great. I'm just kidding. No, it has nothing to do. We won't do that. But thanks for listening, everybody. And we're just I don't know. We have endless energy for this mission to reverse type 2 diabetes in 100,000 people. That's our goal. We talked about it last week. We have a stated goal, and whether you're person 3, 150, or 100,000, we don't feel like resting until it's done. because Brian, I get up 4 in the morning and go for a walk and talk to Brian like 4 times a week because we have so much energy for this. So if you're worried, if you don't think that we're in your corner, we are. So we love to help. We love to share this. And if you have any questions for future episodes like a Q&A or curiosities or comments, let us know. We will respond to them and hopefully answer them. Anything
Yeah.
else, Brian? Or are we
Now,
ready
just
to?
on the note of helping 100,000 people, leave a review. If you found this episode helpful in any way, just leave a review because that's the best way to get this message out to more people, or share it with someone you know, or do both, whichever
Yeah.
one.
Mhm.
And then, like Cory said, if you want the roadmap, check out the masterclass. It'll be in the show notes.
All right. Till next time, everybody. I hope you get so inspired you lose your words like Brian did today. See
Be
you
all
next
right.
time.
Thanks for listening. Now go ahead and hit that subscribe button so you don't miss a single episode, and you can join us on the journey and roadmap to remission. Thanks for listening to the Diabetes Remission Roadmap. The ideas discussed here are for general informational purposes only and do not constitute medical or nutritional advice. We are pharmacists, but we're not your personal healthcare providers. Always consult your own physician or qualified clinician before changing medications, exercise routines, or nutrition plans. Results vary, and what works for one person may not work for another.